Anybody born in 2025 that is not doing their genetic tests will be at a lower accessibility to their health than others that do. I remember shaking his hand and I said to his mother, "This boy is not autistic." He stood up and gave her a hug and said, "I love you," for the first time in 5 years. So that was what changed. I was acutely aware that we were spending a lot of money on healthcare, but people were getting sicker. That didn't seem logical to me.
Where do you actually draw the line between how much to test and what to test?
Changing the diet will elicit a change and you will feel the benefit. This is a truly actionable data set that will change lives. Every single one of your listeners will know what I mean. The cake they eat, the sugar they put in their coffee, the lack of exercise, the going to sleep too late, the stress that they put on themselves. If everyone in the world extended their health by 1 year, just 1 year, that we would save $37 trillion a year. Your ability to be well is not luck, it is training.
The guest we have today is none other than Chris Murray. Chris is the founder of Nordic Labs and is one of the pioneers in defining preventive medicine and longevity. Nordic Labs is a fully self-funded company run by Chris and his partners, and they dive into longevity like no other. They were the first to bring about tests that test your genes, that test your microbiome, and more into what your body is looking like on the inside beyond your regular blood work. With Chris today, we talk about antibiotic resistance, toxins, and about longevity and health in a more holistic way rather than just saying that health is your genetics and your doing. We dive into insights on what would define your future health and how you can take care of it by stepping in right now. And you're not too old to step in at this moment because you're just at the right time and the right place. So tune in to our conversation and see for yourselves on how these insights can make a meaningful difference to your everyday being. So Chris, can you take me back to 1994 when this all started? What was it like?
I think if we go back even further to my, when I was growing up in Sussex in England, I grew up on a big farm. My father had a big garden. He was always growing vegetables. We had livestock. And, the nature was part of my life. Now, I don't think it had any particular role in my decision-making, but it's interesting to see that as I evolve in my business career, I'm always reminded of this time. And a lot of people never get towards nature, never see it. People that grow up in cities, etc.
Yeah.
So at the end of the 1980s in Britain, I was acutely aware that we were spending a lot of money on healthcare, but people were getting sicker.
Yeah.
That didn't seem logical to me. If we were investing, surely we were getting better at what we were doing. And yet, although we may have been getting better on particular areas of disease management, the number of people getting ill was increasing.
Right.
And it wasn't, these acute conditions, someone who fell off their bike and broke a leg or unfortunately got an infection. It was these so-called lifestyle diseases. And that was sort of odd to me. And I felt somewhere inside of me that this was not a normal phenomenon and we should be looking at things differently. But I knew nothing about it.
Right.
Nothing. And I moved to Copenhagen in 1994. And by some sort of fluke chance, I met a doctor who told me that healthcare was changing, that it would all become personalized. And really, I have no background in medicine. I knew nothing about it. And it just resonated somewhere. And I left that meeting. I remember leaving it and thinking, the guy's a little bit odd. Why would he be talking that everything was changing when clearly the main hospital system, etc., was not?
Yeah.
So I went back a month later and had another chat with him. And I left his office that day with him saying, I just remember him saying, everything will be personalized. We'll be looking at the underlying biology of the patient. We'll be looking at the immunology, the digestive system, the hormone system. And I remember thinking as I left his office, this is completely different than anybody else is speaking. And I went back into his office and I said, I don't know what you're talking about, but I'm going to give you 6 months of my life. And together we'll try and work out how we can build a laboratory business to help this area of of healthcare.
Hi, I'm Dr. Sharanya, a medical graduate and a certified physician with a master's in public health and also a master's in functional medicine and bioidentical hormonal replacement therapy. I have always believed that health is more than medicine. It's about resilience, mindset, and the human stories behind every journey. Welcome to Beyond Limits. This podcast brings you conversation with experts, change makers, and everyday people who have pushed boundaries in health, life, and science. From breaking barriers in medicine and science to redefining wellness and uncovering the untold stories of grit. Beyond Limits is about thinking bigger, living longer, and going beyond what people believe is possible. And if you'd like to work with me on a one-on-one or book a consultation with me, you can reach out via the link in the description at the email therealsharanya@gmail.com. It is TheRealSharanya@gmail.com. Let's go beyond limits together. That's brilliant because now that you talk about 1994 was just the time when healthcare was just taking shape in most parts of the world, if I were to say it, especially in developing countries. It was probably the year before I was born. So I can totally relate to you being surprised and you being, all kinds of confused, right? But what made you take that leap? Did you have some kind of an intuition? Was it like a gut feeling? What happened?
I think it's completely intuition, completely governed by the logic that was probably running through me, which was saying, whatever we were doing, and I'm not saying that the medical fraternity was completely on the wrong path, it just wasn't working.
Yeah.
People were getting sicker. Disease was getting more prevalent. Every lifestyle disease from obesity to cancer to diabetes was just growing, and it didn't ring logically with me.
Yeah.
So it clearly needed a different approach. So I don't, and my brain isn't big enough to work out what approach it should be. So I took the inherent, as you say, gut feeling that said this was the right way. And
Yeah.
30 years later, it most definitely was.
And you were Europe's first functional medicine testing laboratory. What was that like when everybody was against it?
Yeah, well, really nobody was listening. Nobody.
Nobody.
I would go and bang on the doors of doctors and say, look, we have tests that can look at underlying imbalances.
Right.
Rather than diagnosis, they're imbalances. They're things that are shaping the human body or impacting the human body.
Mhm.
That isn't in itself going to kill you,
Yeah.
but it is going to change the way you perform. And really, nobody was listening. And it was in the business terms, we talk about virgin territories, something that's never happened before. And this was very much what we were doing. Where we were lucky, I guess, was that there was, from the US, the Amanting group of what's now called the Institute for Functional Medicine, led originally by Dr. Sid Baker and Dr. Jeffrey Bland, who created the logic that underpins what we were trying to do in the laboratory side.
Right.
So we had a nice group of innovative doctors thinking differently and moving the needle that allowed us to at least have some semblance of support.
Yeah, that's brilliant because some form of support is what keeps us going at the end of the day. But what were these established medical institutions saying about you back then?
Oh, they were saying that there was no credibility, that the test was bogus, that they had no value, that there would be no value, no help to the patient, and that we were only confusing them, and that in fact we were just trying to probably steal from them or whatever else. These many clinicians, as you know, don't know that much about biochemistry.
Yes.
And they have been taught that there are guidelines to follow, and therefore that they trust in the guidelines. And I'm not saying in acute medicine that those guidelines aren't very, very important and indeed do save lives. What we saw was this growing group of what we now know as chronic ill, that there was no obvious reason why they were ill. They were being told, well, every blood marker is normal, everything looks normal, just go home, relax, everything will be good.
And I think that is a huge problem we're trying to solve now. So, what do you think is the actual problem? Is it the hospitals, the doctors?
Well, I think if we use the United Kingdom as the example, I don't think there's been any lack of political will to support the excellent NHS. It's a magnificent system that is equitable. It means that everybody has access to healthcare in the United Kingdom. However, they seem to pour more money and the disease impact gets bigger. So I'm not saying that every time you put the money into the NHS, it's a waste of time at all. But what I am saying is that it needs to be rethought. We need to be looking at patients long before they get so ill that we don't understand the mechanisms, that we're having to give very expensive medications, or have to have them in hospital, or have to have operations, etc. So I'm not sure where the breakdown actually happens, other than to say, I believe fundamentally that health is managed by or evaluated by degrees of wellness, and most people are well at some point of their lives, and then there's a deterioration, and it's that deterioration that we have to address, because if we address the deterioration, the disease manifestation or the disease that people end up suffering from perhaps can be avoided. And so I believe very fundamentally that as really good healthcare really does involve the patient.
Yeah.
That sounds a bit odd, because every patient would say, well, I'm involved. But how many patients are really actively doing something to change their diet, change their lifestyle, change their mindfulness, change their sleep patterns, focus on their stress, focus on their breathing, to get their body in sync with the world that they live in? I would suggest many don't, because they don't really understand it. And I think that's the failure of a healthcare system, that it hasn't worked with its patients well enough. They only work when people are sick, and that's a shame. I think that needs to be changed.
Yeah. Is it right from your conversation for me to say that the actual problem is not the hospital, it's not the doctors, but it's the patients?
I think it's the patient's lack of collaboration in their wellness journey. I don't think any patient puts their hand up in the air and says, I want to be sick.
Right.
But they don't understand that the mechanism of change involves them. It's a change in diet, very significantly. There's been a very big publication today in The Lancet that has shown that ultra-processed foods harm every body system. Every system in your body is harmed by the food that you eat, but you think you're eating good, nutritious food. So we have to address that. We have to educate. Over the years in Europe, we've seen different strategies around encouraging people to eat more whole foods, to eat more fruits and vegetables, to be discerning about what they buy.
Right.
But money, the price of food, is influential in the choice of food, and therefore the food you put on your plate.
Yeah. And I think that's a huge influencer as well. And you've currently built your entire empire on this one philosophy of n is equal to 1. That is such a personalized approach. What do you have to say about it? Because, are the systems not working? And why do we need this n is to 1 approach?
Okay, if we look at the philosophical approach and perhaps the pragmatic approach to healthcare, governed by governments and need to protect the whole population, there is no doubt that public healthcare policy revolves around the masses, not the individual.
Mm-hmm.
But it's the individual who gets ill. And we've known for a very long time that each of us have different biologies, are exposed to different things, are exposed to different illnesses, have different recovery rates, eat different foods, drink different water.
Mm-hmm.
So the n equals 1 is suggesting that you are unique in every biological facet. The way that your body interacts with the food that you eat, the way that your body interacts with the stresses of life, the way that your body reacts to your ability to convert the macronutrients into usable biology or biological function. It's all unique. And so understanding how you function, not how your brother, your sister, your mother, your father, or your friend, that is irrelevant. It is how you function in a biological status. And in the last 25 years, the greatest thing that's happened is we've understood more and more about genetics.
Right.
And each one of us, the difference is in our gene pool is very, very small. And yet those small differences elicit the individuality. And it's that individuality that reacts to the world that you live in, the food that you eat, the water you drink, etc. And we know more and more about this. And so testing your genes and understanding how you function and making the changes found within that gene information can help reduce, mitigate disease manifestations.
Right. I resonate with whatever you said, but a lot of critics may say that this kind of personalized medicine creates anxiety in like a health anxiety and turns healthy people into patients. How do you have to respond to that?
I think, again, it's education.
Hmm.
I do a lot of things myself for my health that is all prophylactic. It's not because I'm ill. I take a lot of supplements. I eat only organic food.
Hmm.
I try to do the right exercise. I'm doing cold immersions. I'm doing saunas. I have a hyperbaric chamber at home where I get oxygen. I'm living the life that I perceive to be the most important aspects, or delivering the most important aspects to healthy living. And I don't have health anxiety. I don't wake up thinking, "Oh my goodness, I wonder if I don't do that, I'm going to get ill." I don't do that at all. I'm constantly building what I call a longitudinal data set about how I perform, and then trying to work out, can I perform even better?
Right.
Can my brain function better? Can my movement function better? Do I have any aches? Why would I want to have an ache? These are the types of things. So I sort of understand the narrative, or we call them the worried well.
Yeah.
But I'm not worried. I love every aspect of what I do for my health. I think it's engaging. I think it's fascinating. And the greatest thing in the last decade is this shift of people who have become aware that they can function better if they maybe fast more often, if they change their diet, if they look at the inflammatory processes, if they look at the digestive processes. Many, many, many people suffer from pain in their abdominal area, in their stomach, from the food that they eat or the lifestyle, and they just learn to live with it without getting too arrogant here. I have no pain.
Yeah.
I don't know what a stomach ache feels like, but I'm very conscious about the food I eat. I'm very conscious about testing myself, testing what's called the microbiome to see what the gut, how it functions, testing how the immune function is against the foods that I eat. This is normal for me, and it's helped me live a tremendously healthy life over the last 30 years. I don't think I'm concerned about the way that I live.
Right.
I'm far more concerned about getting dementia in my 70s, and I would prefer to avoid it.
Right. It's powerful and brilliant, whatever you just told me, because maybe you and me know what that we're talking about, but maybe an average person does not know what we're talking about, right? They might think that, okay, this is all fancy, it's all expensive, it's all a lot of fear mongering, supplements are fake. What is it that actually cemented your belief in saying that I saw this case and I've changed this person's life?
Okay, I'm going to answer it in two ways. Firstly, getting data on how you perform becomes a very good way to ascertain whether what you're doing has the effect. So if, in very simple terms, most people have heard about in heart health that we measure triglycerides and we measure what's called LDL and HDL and cholesterol. These are quite normal terms today. Everybody is aware that if you have the poor LDL, high levels of LDL, that increases the risk of having a heart attack in very broad terms. If you could measure that you had good LDL, the low levels, and you have lots of HDL, and that's protective, then you are empowered and you know that your heart health is in good shape.
Yeah.
If you had that higher level of LDL and you started nutritional interventions, maybe you changed your diet, maybe you fasted, maybe you did more exercise, things that we know about, then those levels of LDL will come into the normal. That would be also gratifying.
Yeah.
So to say that, a supplement might not work, it's true, it might not work. But so too might the medicine that the doctor gives. But if you can measure it and identify how is it working, then I think it becomes very compelling. Additionally, I would say that I don't look at food supplements as anything other than being a very important part of my overall nutrition. I do not view them as medicines. I do not view them as a difficulty in my life. They are part of my life, and I take very many of them, maybe up to 30 a day. I'm not advocating everybody does that. It's taken me many years to find out what I need. But testing and then reevaluating and changing maybe the nutrients that you're eating, changing the diet, will elicit a change, and you will feel the benefit. That I'm convinced of. Now, to answer the question in a different way, what convinced me that we were on the right path? I go back to 2001, and it's a very long story, which I'll try and bring into quite a shortened version. But a mother of a Asperger autistic child, he was 13 years old. She called me up one day after she'd listened to one of our lectures about how we can look at how the brain functions with how it interacts with the food that you eat. She got quite upset that she hadn't heard about it before, and she demanded to have the test. So she did the test on her son. And 3 months later, she rang me back and she said, "Now what do I do?" And so I said, "What do you mean? How's your son doing?" She said, "I wouldn't be calling you if I hadn't seen a benefit." Okay, so we're now going to look at all his biology, how his large intestine functions, how his small intestine, how is the immune system, how's the fatty acids, amino acids, everything that builds into the nutrition of a child. So we did all that. And then another 3 or 4 months later, she calls me up and says, "I'd like to bring my son in to say hello to you." And I said, "Oh, you don't need to do that. I mean, I'm happy that he's doing better, but please don't put him in a car and drive all the way to the city." And he said, no, he's much better. And I said, "Well, he doesn't like noise. He doesn't like the cars. No, it's all fine. He wants to say hello." So he came all the way into the city, and I remember shaking his hand. And he said, "Hello, my name is," and I won't say his name, but, and I shook his hand, and I said to his mother, "This boy is not autistic." And she said, "You haven't seen him before. You don't know." So at Christmas of that year, she wrote a very long letter to me, thanking me for bringing her son back. And the reason why she called me the second time was the day before her son had said to his cousin, "Please go and get my mother." The mother came in and he stood up and gave her a hug and said, "I love you," for the first time in 5 years. That convinced her to do the next thing, which was all the hard work. And as clever as we are, that boy would not have got better without his mother doing everything she possibly could to change his diet, to give him the right supplements, to give his body the right nutrition.
Right.
And to test and to evaluate to make sure it was working. To cut a very long story short, that boy, who was in a special school costing the Danish government a lot of money, ended up going to normal school. He ended up going to university. He is now married with 2 children. He is a teacher at a school, all because we could find the right biology.
Right.
So that was what changed me.
That is empowering. It's inspiring. It's empowering because I know a lot of kids go through disability.
Mm-hmm.
We know that Alzheimer's, autism, there is ADHD, which is now picking up so much. And to know that we have the power to change it.
Absolutely.
And I'm in disbelief because the medical system tells us that once you're autistic for life.
My advice to anybody who has a child with learning disabilities, do not get a diagnosis.
Mm-hmm.
I'm not saying that the diagnosis isn't important at some stage, but let's really understand the physiology of that child. Make sure we've tested everything possible. Yes, it's difficult. Yes, we don't understand why some children react one way or the other.
Mm-hmm.
But biology is immensely robust. It can build pathways and survival, or it can make changes so that they can survive in the world of stresses.
Right.
So my advice to anybody with a child with learning difficulties is we need to test them, not for neurological function. We can see that might be impaired, but from biological function. How do they digest food? How do they uptake the nutrients? Are they getting enough nutrients? Are they able to eliminate the waste? Are the toxins that are involved, are they eliminated? Lots of things that can be evaluated and hopefully can help the neurology of that child to function more under what we would quote unquote normal environments, but are not then diagnosed with an autistic.
That's brilliant and it's empowering. That means we're going to save so much money for our governments because it's a lot.
I think
Special
so.
education is different. Care for the special is very different, and it all requires time and money and effort. But all of that being said, functional medicine testing is quite expensive at the moment. Are we creating like a two-tiered system? It's only for the rich, and the regular population can't afford it.
I think that's a fair question, and I'm going to answer it in two ways. One is my job has not been about being the deliverer of governmental health. It's been about showing that if we make changes, that real change can be achieved.
Right.
Now, these tests are expensive because they're not covered by
Insurance.
government or insurance.
Yeah.
That is a question we should be asking policymakers, insurers, because the cost of living with autism, as you just said, isn't just about the medication that the government might have to pay or the special school that they have to pay. It's the lack of productivity in both the parents who have to look after that child, but also the siblings that may be affected, and of course the child themselves that may never reach a level of ability to provide in a society that demands that we all work. So yes, it's expensive for the family, and we need to change that. We need policymakers thinking about, can we get there?
Yeah.
The unfortunate thing is for policymakers, and I understand it, is that they're still having to consider this N equals 1, which we spoke about earlier. The one individual, we have to have a workup of that individual to see how they function. That is not easy, and it requires excellent physicians to understand those processes. So it needs a retraining there. So it's easy for me to sit there and say, yes, this should be paid for, and I understand what you're alluding to in the two-tier system, which I do believe there's a risk of, and we have to find ways to make this accessible. But my job is to, first of all, demonstrate that this is possible, and then let policymakers find the route to be able to provide it to everybody.
Right. I think that's a valid argument to make because at the heart of public policy is that one person that we're trying to help. Also, we're also trying to help the community as a whole and a country as a whole, where we try to progress and be more productive. And at the end of the day, that's what a country needs. But there is always this debate, right? At least at the moment, that this is only accessible to people who can afford it.
Yeah. I mean, again, what is accessible to everybody is vegetables and fruit. And if you did nothing else at all, and you changed your diet away from these ultra-processed foods, the ones that are packed in lots of plastic, are packed in cereal boxes or something. These are ultra-processed foods. We do not need them. Full stop. Think back to just 1 or 2 generations ago. What did we eat? It was a lot more natural foods, whole foods. Cut out all the junk. Cut out all the bars of chocolate and the sugary drinks. I literally do not drink a soda at all.
Yeah.
I'll drink water, and I always remember my dad getting, years and years and years ago, would get angry about having to buy water. Why would we buy water? It's so that you can get it from the tap. But society says that we go out for a drink, etc. I have no qualms about buying sparkling water or still water and paying equivalent to what a soda is.
Yeah.
That's not a problem. It's a choice, and I'm very clear I don't want the sugar. So it's not difficult. I choose to think that the next level up is all about your performance. If you really want to work out how to defeat disease, how to be the best version of yourself, you need data. But you can live a good life without the data.
Yeah.
But if you want to be let's call it the Superman or Superwoman or the top of your game, we can't sort of guess. We have to have data. So that's where we're moving towards, is that data set that helps us understand how we can perform better. But that doesn't mean that good health isn't accessible to everybody.
Right.
They just have to make the decisions, and they have to be self-determinant. They do not follow the advert. Do not walk into the supermarket and buy the cheapest, most bling bling product. You find the nice piece of fruit, and you find the nice vegetables, and you go home and you cook maybe a soup like your grandmother would have cooked. It's not that difficult.
Yeah.
We try to find excuses for not living healthily. And I think every one of us can make very significant changes to our health without having to spend large sums of money.
You know, that's brilliant because it's those little changes that we make. You know, it could be like rather than grabbing coffee in a plastic cup, just grab it in your own cup. That might be a metal or a glass or anything, because we know the PUFAs and the polyunsaturated plastics are very, very bad.
Yes.
And that being said, you're now moving towards testing what is measuring antibiotic resistance, drug resistance, and tell me about it.
This is the whole antibiotic resistance problem is a very serious one that is going to affect every part of the world. And it unfortunately will affect those with immune compromised conditions first. So we have to address it, and we have to address it very quickly. What does it mean? We have in our environment bacteria, fungus, parasites. They live alongside us. They always have done. We are made up of lots and lots of these microbiota that live in our gut systems, on our skin. We are part of nature. Now, perhaps the most phenomenal thing of the 20th century was the advent of antibiotics. And so Alexander Fleming in Britain in the late 1930s managed to both isolate and produce the antibiotics that we all know about.
Yeah.
And it has saved millions, maybe billions of lives, and without doubt has been enormously important.
Right.
However, just imagine this. If you were having someone hit you on the head, what would you try and do? You first of all try to avoid it.
Yeah.
And then after you've tried to avoid it, you might find a way to put a helmet on your head so that when someone hits you on the head, you didn't feel it. And then after a while, you got your friends and you said, look, this person keeps hitting me on the head. I found this helmet system. Why don't we all put a helmet on and go and attack the person who's hitting me on the head? And then your friends go and attack the person that's been hitting you on the head, and the person that's hitting you on the head no longer is effective. That's the first time I've ever given that analogy, but I think it's quite an interesting one.
Yeah, it's an interesting analogy.
But that's how antibiotics work. So the antibiotics are aimed at a bacteria, and normally, in the past, it's killed it. But bacteria aren't stupid. They're very adept to change. So they make those changes. As they change, they get the resilience against that antibiotic. And so no longer does that antibiotic work. In fact, what it does, it kills all the other bacteria around in the gut system. Yes. And it allows that one bacteria they've been trying to get at to have an attack on the system. And that is when we have this so-called antibiotic resistant bacteria. So a few years ago, we invested in a company in Finland called Resistomap that is looking at these resistant bacteria as a threat and measuring it across the world. I think we've now measured 58 countries, and we know where these resistant bacteria reside. We know the threat. The European Union knows the threat. The British government knows the threat. Most governments will know the threat. So what do we have to do? First of all, we must reduce the amount of antibiotics used around the world. 75% of the world's antibiotics are used in agriculture. Why? Lots of questions. Fishery, lots of spraying with antibiotics. Avoid eating fish farmed or farmed fish because they have lots of antibiotics. We should be avoiding animals that have been injected with antibiotics wherever possible. So that's one area. The other one is to build the resilience in your body so that should you get infected with the bacteria, you have the strength you automatically have the strength to defeat the infection. So I last took an antibiotic in 1994, a long, long time ago. I'm not saying that everyone's as lucky as I am, but you should be very cautious, very, very cautious about when to use them because you need them later to save your life.
Right.
You do not need them for a cough that you've just developed. So people have to be also cautious about the use of it. And we need to have doctors who be far less willing to prescribe and far more willing to look at the overall function of the body, because once these resistant bacteria get full control, death will happen at very large numbers. And the United Nations has predicted by 2050, but there's always updates on this, so it changed a little bit, but around 10 million deaths per annum will occur because of the failure of antibiotics. And I don't think it's a sensible process just to keep on going. We have to stop, we have to look at it, and we have to make changes.
Can I ask you a very trivial question? Why are governments not acting at a faster pace when we know that this epidemic is going to come and roll us over more than Corona or COVID did?
Yeah.
And we're not going to be able to stop it.
No, we're not. I think there's a benign hope that we find a new antibiotic. I don't share that hope. I think we will find half solutions that will perhaps help us in a shorter period of time. But we have to rethink completely the idea of the isolation of that bacteria and the elimination. I think we've moved a long way from that anyway.
Mm-hmm.
Governments are aware of it. There is action plans. As I said before, the EU is perhaps the most aware. The British government is very aware. The EU is very aware. But how do you shift an entire generation of people that are used to going to the doctors for an antibiotic? So it's participatory. We all have to be participatory in it.
Mm-hmm.
We have to understand that the threat is real. It will happen. It will happen. But we can mitigate it by making sure our bodies are resilient. And that's the term I use. Build resilience in your body. Use all those resources that I was speaking about earlier, the N=1. Find out how you function best. Avoid the things that are pro-inflammatory. Avoid the challenges that impair your gut system. And you will be able to defeat the infections that come along because your body will be so strong.
Right. That's, I think, the only thing we can do at the moment, at least for the most population. Now, what is that, biggest scientific breakthrough that your labs have made that no one is actually talking about?
I'm very proud of some work we've done with our American friends. It's something that we've called Grow Baby. It's a genetic test. One of the big, I would say late 20th century, early 21st century challenges has been the ever-growing number of preterm births.
Right.
Preterm is, I think, anything less than 36 weeks.
Mm-hmm.
And the impact of a preterm baby is, of course, very obvious to the mother because the child goes immediately into an incubator.
Mm-hmm.
There we have a wonderful system to keep little babies alive. That's fantastic.
Right.
But they're not yet ready for the world. Their systems aren't ready. So the cost of keeping that little baby alive is very big, number one. The cost to the child in life is quite significant.
Mm-hmm.
The cost to the parents
Mm-hmm.
is significant, and the cost to society is. So the numbers of preterm birth is somewhere in the lowest in Europe is Finland at 6%, and it goes up. In the United States, it's 10, or the UK, it's 8%. The United States is 10%, or there and thereabouts. I found out in the Philippines, it's 15%, and in India, it's probably somewhere between that, 10 and 15. What we have done is found out that and this is work done by Doctors Michael and Leslie Stone and Emily Ryburn, and they found that the genetic makeup, together with our team, of the mother to carry her child to full term was now understood. And we did a trial at the University of Las Vegas that showed that we took a 10% preterm birth rate down to 1%. We also helped reduce significantly the risk of miscarriage. We also reduced the risk of gestational diabetes. So this is a truly actionable data set that will change lives. And that's, I think, one of the
And that's
proudest
wonderful
things.
because I always tell my patients that, your diseases didn't start the day you were born. Your diseases started way back when your genetics have been carried by your forefathers. You probably had all of this when you were an embryo, right? And it's brilliant that now we finally have tests to talk about it, finally have tests to support evidence because you are your genetic makeup at the end of the day, right? And that being said, you're measuring genetic testing, whether some people call it necessary, some people call it unnecessary. Where do you actually draw the line between how much to test and what to test?
Let me make this very clear. Anybody born in 2025 that is not doing their genetic tests will be at a lower accessibility to their health than others that do. So I don't think it's a question, should you do your genetics? You must do your genetics. Now, then you can ask the question, which gene should I be testing? Do I want to know I'm going to get I'm at risk of a specific disease that I can't do anything about? And the answer to that is, I think, no. I don't think we want to know that. But lifestyle diseases are predicted somewhat within your gene makeup. And if you know which risks you have, you can change that. And you can change it to the betterment.
Right.
So I dismiss 100% the idea that genetics aren't helpful in your overall health span. They are most definitely helpful. Each of us has slightly different patterns, and those patterns then play into the robustness and resilience of your ability to live a healthy life. So learning about them and not being afraid of them is very, very important. And the genes that we look at are those that, first of all, have very clear evidence. I'm not saying it's perfect evidence. We don't know everything, but we have a lot of information and it will keep getting better and better. So we choose those genes we know have credible evidence. We then look at those, and we only include those genes in our panels that you can adapt by environmental change. That's either changing your diet, exercise, changing exposures, getting better sleep, doing mindfulness, breathing, what have you. These are all possible from understanding the gene and then the interaction. And that is your uniqueness. You are unique, and it stems from that genetics.
Yeah.
Just answering on your point about when does disease start, I don't necessarily think it starts in the embryo, but the information for the risk is in the embryo.
Yeah.
Once you're born, most babies are born healthy. They're pretty good.
Yeah.
They look good. And as they go through the first 6-7 years, they develop their immune systems and they're doing all right.
Yeah.
And then from puberty onwards, we see exposures to disease, problems that occur. We don't fully understand it other than it's often environmental. And then once you start on that slippery slope of a, let's call it a disease manifestation, even though it's not a full disease or disease risk, you start I need this medication, I need this, I need that and the other. But if we'd already understood it at birth, you have these genes here, let's make sure you don't get exposed to inflammation because inflammation might lead to this because your gene expression is impaired or challenged with inflammation, or your what we call detoxification is impaired. If we understand that, we can support it. So genetics is very, very important. And the more you learn about your uniqueness, the more likely it is that you will avoid the challenges that many others suffer from because they don't understand them.
No, that's valid, and it's completely something that we should, now that you say about it. But I know for a fact that you are into biohacking and you've been doing that for a couple years now. You have implants and you're into hyperbaric chambers and a lot more, like in terms of really optimizing, where your health is. Now, if I were to say that, you're essentially backing yourself by biohacking and experimenting on yourself because, if something were, to go catastrophically wrong, with one of your experiments, does that undermine everything that you have had to build?
Okay. First of all, I haven't been doing it a couple of years. I've been doing it 30 years.
Right.
All right. Most others have been doing it 2 or 3 or 4 or 5 years. I've done it for 30 years. It's the first piece of biohacking I did was in 1995. I began getting the data about how I perform. Yes, I do. I have a chip in my arm that helps measure temperature. I wear the rings that help us understand how we sleep, how we move, how much we move, what our heart rate is, heart rate variability, these types of things. I believe that helps me understand much more about those risk factors, not of a catastrophic moment, but rather, okay, keep assessing how you're performing to make sure it's not going the wrong way. I have a hyperbaric chamber at home. It's something that I find deeply helpful to the way that I perform. I run multiple companies. I have to be traveling the world constantly. I have to make sure I'm performing at the best possible level. I do also, this year I've been doing these what we call phoresis, where we drain the blood for the plasma in the blood for all the toxins. We try to remove the toxins.
Right.
Now that is relatively new. I'm not saying to everybody go off and do a phoresis. However, there's enough evidence to suggest it's pretty interesting. Is there going to be a catastrophic moment? I don't know, but I feel that the human body, is immensely strong if you give it the resources to perform.
Right.
And that's my job. That's what I'm trying to do all the time, to build the best defense mechanism I can against the risk of disease. And I will keep challenging and I will keep asking the question. We get more and more and more knowledge about how our biology is and what impacts it. So being blind to that, I think, is a little bit silly. If you can read the scientific literature and be critical of it. You have to be critical. You can't believe everything you read, and every Instagram that's put out there is got to work out, is it there for me, or is it there for them to make money? But if it's good scientific evidence, it doesn't have to be massive studies. It just has to be sound science. Then I'm interested to employ it.
Yeah. That's brilliant, because not everybody is up to take up challenges to optimize themselves. I kind of put it like this because not everybody is ready to be the best version of themselves at all times, to be performing, because some people are okay with being sub-performers. Some people are okay with being average and they accept it. And that's okay too. But it's also important to know that for those of them who want to really get to the top of their health, perform, and then really take out that every potential from your brain cells, it's important. Now, that being said, what is that biggest health myth you think should actually be put to rest today?
Okay, the biggest health myth. I don't know if it's one specific thing, but we are very, as humans, so I just told you I have a chip in my arm.
Yeah.
The chip in my arm measures temperature. And the first thing people say to me is, what else does it measure? And I go, I've just shown you something you've never seen in your life.
Yeah.
And the first thing you ask me is what else it does. That's the way humans behave. Oh, I've just heard something, but what else can it do? In the world of healthcare right now, there is any number of new tests, new supplements, new food propositions, anything, new technologies to make you move differently, etc. I find that marketing and not real science. It's not being qualified, and there's lots of noise around this. So my advice to people is, don't try and Instagram your way to your health. Find clinicians who have really studied this area. Use them not as your doctor of disease, but your coaching clinician, somebody that can help you on your journey to keep increasing that performance. Over time, you will learn more and more and more, and you'll feel more and more comfortable and confident. But just because you have a headache and someone tells you how that by taking this pill you're going to get better,
yeah,
I think that's a dangerous area. We need to find and encourage doctors to train in this area of precision wellness. This idea, and I've just joined the board of the Yale School of Nursing, who have a department called Precision Wellness. Fantastic that one of the major universities of the world is now looking at this very specifically.
Right.
precision wellness, not precision health or precision disease, or precision medicine, precision wellness. So how do we find that? You cannot just, again, you can't Instagram your way to finding that. You must work with a clinician who has an understanding of how your body functions.
Yeah, I think that's a brilliant piece of information because I also run a social channel and all of this, and my patients come up to me and said, doctor, I saw this on Instagram. Can I please get it? I'm like, yes, you saw it on Instagram, but that does not mean it's the one that you need.
Correct. I mean, and that's what I'm alluding to. The world of health has become really trendy, and very powerful marketing events are happening. Just because people are listening to you and I speak now doesn't mean that what I do and say is right for them.
Right.
They must find the right biological assessment to find out what they need.
And how do you suggest they go through on this journey of finding a right biological assessment for them? What would be your go-to to, tell them that this is how often you should test and these are the things you should test, at least the bare minimum?
Okay, so now we're going to put aside the discussion we had earlier on about access and two-tier systems, etc. We're now going to think what is optimal. What can we really do? What I do is I test myself every single month on one thing or the other. And I'm not hysterical. I'm not looking at, oh my goodness, this is a disaster, I've got to change it. I'm very, very, look at this area. Can I change this? Should I be eating this differently? Should I be doing more exercise? Should I sleep more? And all the time, just adjusting slightly because I'm not ill, at least not obviously. And so if I can make those changes, I can hopefully prevent any disease happening. So in my opinion, you've got to get the data set. You cannot just say, well, because my friend did well doing this, I'm going to do well. And we need to find that coach, that doctor. And I'm a big believer that the next generation of physicians will have this element of A, N equals 1, and 2, the mitigation strategies. What do I do with a well person? Not what I do with a sick person. What do I do with a well person? How can I help them stay well? How can I mitigate the risk? And I think those clinicians will have a very important job to do, and B, find that their job is wonderfully exciting because they're able to change lives very much from the perspective of performance, not one from pulling them back from the edge of disease.
Right. I think that's an important take home because we're seeing medicine change rapidly. And if there's one thing that you want to take, as an advice that, no matter what stage of life you're in, this is one supplement that you should take, what would your go-to be in terms of that?
So I've just said before that we have to be careful
Yes.
about saying the one thing for everyone. But the one thing for all of us is that nutrition is our basis of life and survival.
Yeah.
Full stop. So we must make sure that the foods that we eat are delivering that very, very important job. So my first point to everybody in the world, doesn't matter where they are, is please source your food from places you trust. That is not necessarily the supermarket, but it is the farmer. Find the best farms. I would advocate very strongly, very, very strongly, that those vegetables that you eat should be as organic as possible. We don't need all these sprays. We don't need all these pesticides. We don't need all these herbicides. Yes, I know that to get higher yields of product, that's what farmers do. But I don't need a great big melon. I need a very nutritious melon. And that is different. So organic, as the world created, without all these man-made things, is the number one thing. That's what I would say to everyone. Then the supplement that we all need, in my opinion, certainly in today's modern society, we do not get enough of the food necessary for good DNA replication. And that is because we don't eat enough broad spectrum foods, including offal meat, where we have what we call one type of nucleotides. And nucleotides are the very important form of replicating DNA. You We have two sets, purines and pyridamines, and the pyridamines are deficient in our diets today. And so the one supplement that I took every single day is nucleotides. And we have a product called Nucleox that contains these special nucleotides to help with our DNA replication. This is food. It is not medicine. It is food. And we're just lacking it in our diet. So that's why you would have a supplement.
That's brilliant, we talk about nucleotides, we talk about protein, because now the entire conversation is all about your protein, fiber, protein, fiber. Have you got enough? Have you not got enough? So it's important that we put in the science back that, your purines, the pyrimidines, the nucleotides, they're the building blocks of our RNA and DNA. Now, that being said, you are a busy man. You are, always traveling, you've businesses in 80 different countries with multiple portfolios. What was your biggest challenge when you were trying to build this out? And how did it happen, over a period of years without any funding?
Correct. So I'm quite a different business person than most. I'm in it I'll try and describe it in two ways. I'm in this because I love what I do. I absolutely love what I do. It is not important about how much money I make and how much money I have in the bank. It is important that I make a contribution to the world, that I help keep challenging the way that we've been doing things. So when we started the company way back in 1990, well, officially it started in 1997, we had nobody believing in us. Nobody. So I said to Anne-Catherine that we have to do this ourselves. And we had really no money, but we had a lot of endeavor. And we just worked, and we spoke, and we read, and we went to meetings, and we learned more. We didn't go out for dinner. We didn't go to the cinema. We didn't do all the things that people perhaps do. But we created the value proposition for our business. From there, we got customers. And the customers luckily paid us.
Mm-hmm.
And when they paid us, we got the money into our bank account to help us grow. And so that today, as you alluded to, we have a very complex business across many different countries. And we invest in healthcare companies that are going to change. They're going to make the changes. And that's really our ethos. We still have never taken a bank loan. We have no debt. We are very conscious that we are participatory in what we call a healthcare revolution. And our job is to be part of that, not to own it, not to dictate it, but to help guide it. And I think that's what I do.
No, that's brilliant. If I were to ask, what was the biggest challenge that you had? And what was that one deal which you said, we've made it?
The biggest challenge always is people buying your product.
Yeah.
And convincing people that you have something of value. And I never wanted to use my network to support me. I needed to have the products be bought by clinicians because they added value.
Right.
And the turning point for me was the end, probably 1999. I was in a clinic in Oslo, and I remember these 4 or 5 doctors who finished the meeting with me, and I didn't know which way it was going to go. And they surrounded me just before I got on the elevator, and they thanked me very much for coming and speaking to them about this, and that they would most definitely be employing our tests because they could see the value proposition for their patients. I think that's the day I knew we had crossed the Rubicon and we were now going into the new world of opportunity.
Right.
And since then, doctors have been coming to us from last year, every month we sell to 130 different countries around the world. It is constant and continual. And it's a very big responsibility to look after people's health across the world. And we are just part of that story. But to see all these doctors wanting to work with us and coming to our education and spending 3 days like you did in London here, it's a deep privilege, honor, and a big responsibility. But we're all together working towards the aim of changing healthcare, and that is what drives me.
That's a brilliant drive. I think it's included with a huge purpose to what we're doing to humanity in terms of having a healthy population. And you've always said, right, we could live up to 100 disease free. What is stopping us from doing it right now?
Poor choice. Poor choices. Constantly poor choices. And every single one of your listeners will know what I mean. The cake they eat, the sugar they put in their coffee, the lack of exercise, the going to sleep too late, the stress that they put on themselves, whether direct or indirect, the inability to understand the uniqueness of their bodies. But I genuinely believe that any child born in 2025 that has tested for their genetics, is constantly monitored for performance, not for disease, that is given the right nutrition, fed organically, given the exercise environment, made sure that their cortisol and their stress function is optimized, and continually go back, just as I've done in the 30 years, I think it can be achieved very easily, and people will get to 100 disease-free. I'm not overly convinced myself that we're going to see people living to 150, but I'm told by many clever people at universities around the world that it's going to be possible. So let them prove that. But I do believe that we're going to get to 100 without disease. And it surely is our responsibility to our fellow humans that we're kept as healthy as possible. It's not a right to get healthcare.
Right.
It is a right to prove yourself to be well. And in us doing that, we would expand what we call health span. And the health span is the time of your life that you are well without medication. Typically in the Western societies, you have around 10 to 15 years of when the health span ends and lifespan ends. That is too long.
Yeah.
And we have to narrow that gap. The cost of if everyone in the world extended their health by 1 year, just 1 year, the calculation was made that we would save $37 trillion
That's
per
massive.
year.
That's massive.
So if there's any business people listening to this and they don't understand just how big it is, the
massive.
opportunity is huge to be well.
Yeah.
Not for disease. So
Yeah.
we have to flip a lot of things. We have to engage people earlier, much, much earlier. And we have to explain to people that your ability to be well is not luck. It is training. And you keep training your body to receive the right things, you will live a healthier life.
Yeah. There's no dearth of information when I have to talk to you because it's like an encyclopedia. You've built so much in terms of health and well-being and so much. And something that you've built extraordinarily today is Grow Baby. Can you tell me about why a genetic test specifically for pregnancy? What gap are you trying to actually fill here? I know you previously mentioned it was, the preterm births and all of that, but what is the real gap?
Well, the real gap is absolutely this late 20th century growth in the number of preterm births, which has no doubt modern medicine been fantastic in helping to keep little babies alive, no doubt. And there are any amount of documentary evidence that this has helped not just survival, but families, etc. But the number of preterm births are just going up. And this doesn't seem logical to me. The British government, both Houses of Parliament, the House of Lords and the House of Commons, both have a strategy to reduce the British rate from 8% to 6%. That's quite unusual that they have in both houses a strategy to reduce a societal problem. So why have we got to these levels? The challenge that I'm seeing isn't just that some babies are born early, and probably they've always been born early because that's just part of natural cycles, and very often in the past those infants would have died in childbirth. But what I wanted to query or challenge was, is there a biological impact that's not being addressed that, if we understood it better, would enable a woman to take her child to full term and deliver it at normal weight, which are two of the biggest mitigators, two of the biggest reasons for avoiding disease in their whole life. this is very, very important. I'm very fortunate to meet people from all over the world with tremendous talents, really great thinkers, challenging the status quo. And my very good friends, Dr. Michael Stone, Dr. Leslie Stone, and Emily Ryburn, who is a clinical nutritionist, were already working away at this from what we call a phenotype perspective, looking at what things were affecting a pregnancy.
Right.
And Dr. Michael Stone and I had a conversation, funnily enough, in Manila, some now 7 years ago, I guess, where he said, do you think your team can develop the genetic profile for understanding why a woman might not be able to carry her child to term? And then we looked at certain phenotypes. So miscarriage is one. Another one is gestational diabetes. Another one is preeclampsia. And we wanted to say, could we help her avoid those problems whilst at the same time carry her unborn child all the way to term? That was the problem. But we believe that with good information, first of all from the biology, secondly from the counselling and the coaching, we could change that. And the team in America did exactly that at the University of Las Vegas. They did a clinical trial where we saw 100 women go through pregnancy and with a predicted rate of around 10 or 11% to have a preterm, ended with just 1%.
Wow.
So that is, irrespective of anything else, a huge, huge, huge win for the child. Secondly, for society, because the cost of a child being born preterm in the United States is around $65,000. Interestingly enough, in the UK, which probably calculates things slightly differently, is around $75,000. The UK cost of preterm birth is £3.4 billion per annum. Every year, the British NHS pays £3.4 billion to protect the lives of little infants born too early, which is a wonderful thing. However, what if we could have got all those children to term?
Yes.
And that's what the problem that we're addressing. And we've just been funded a second time for a very big study in North Carolina that will begin, I believe, in January of next year and run for a couple of years so that we can produce clear evidence that genetics, phenotype, coaching changes the pregnancy and therefore the outcome of many, many, many humans.
It's brilliant. Can you tell me what are the key biological pathways, that Grow Baby measures, and what does an average pregnant woman not know these?
So I think, let me answer the second bit first. We've always, in society, had children through a normal biological process, right? That's a fact. And so what we're saying is we're not changing that. But what has happened in the last 25, maybe the last 40 years, is the exposure to modern living has had an impact on the way women are carrying children.
Right.
It certainly has had an impact on the cost of these early births. So why is the question? And there are probably multiple impact factors that play into those phenotypes of first of all, miscarriage. A lot of women suffer miscarriage. Why? ? So we want to challenge that. Do we understand the biology of that? Can we change that likelihood? And again, I think we've mentioned previously about N equals 1. How you are as a person is unique. And understanding that biology helps you understand, if you're a woman of childbearing age, how you're going to carry that child. So that's the first thing to work out, find the uniqueness. Then we're going to say, okay, what other areas can we look at? Preeclampsia is one. Another one is gestational diabetes. A lot of women today develop gestational diabetes and are told by their clinician, do not worry, we'll give you a little bit of insulin, everything will be fine, your child will be fine, don't worry. And in terms of pure process, that is true. Yeah. However, women that develop gestational diabetes, on average, will develop type 2 diabetes within 9 years, and their child born because the mother had gestational diabetes is, I think, a 3 to 4-fold increased risk of developing type 2 diabetes in life. So there was another thing. could we change that? And then finally, can you carry that child to be delivered to term at normal weight? Not too large, not too small. So in there, you have a load of genes that play into that role. And we've learnt that over the last 25 years. And that's what we adapted into our Grow Baby test. Mm-hmm. Additionally, we looked at the nutrition of women, their vitamin D level, their fatty acid level, their what we call, there's an amino acid called carnitine and zinc. And we looked at this to say, is there deficiencies here? And then with that information, we coached the younger woman who's not necessarily that interested in finding out about nutrition, etc. But they, once that was found, we were able to change the outcomes. And I want to say one other thing is the interesting thing in our study that we didn't think about, we didn't coach about, we didn't do anything, was that the number of women that breastfed their child was 91% compared to what was predicted to be around 50 or 55%.
That's a big change, because I know for a fact that breastfeeding is an essentially utmost important part of a baby's life,
Yes.
right? Because we get all of our gut bacteria from the breast milk, and everything is from where that starts. And we see those numbers declining because earlier, previously, generations-wise, all babies were breastfed.
Yes.
And today we're having to rely on formula for various reasons. Now, if you were to say, I always tell my patients that pregnancy is a process you start even before you decide that you want to get married.
Absolutely.
What is that thing you tell all women should do if they're, preparing for childbearing, or even if they have like a 1% idea that maybe I want to have a child someday?
So one of the things I've learned over the last 2 or 3 years, as I've become very, very interested in this whole area, was the fact that you as a woman were given the oocytes, the eggs that you're carrying in your life, that you will ovulate by your mother. Mm-hmm. So the grandchild is in fact has received the eggs, the oocytes from the grandmother. And that's a wonderful piece of biology just there. So why are we looking at the modern way, it's the always way of pregnancy is suddenly one day you wake up and you find out you're pregnant.
Yeah, that's right? What we're shown in ads.
That's what happens though, in most cases. But as we've aged, as we've got into this new generation, the 2020s, we've got this idea that biology plays a much more important role. So indeed, as you're alluding to, let's start, if you want to have it, I'm going to call it the uber child, the top functioning child, the fastest, the tallest, the quickest, the brightest, the best looking, then you need to start preparing. You need to give that child, the unborn child, the unborn fetus, the even unconceived fetus, the environment to perform. So if I was having children today, without doubt, I would be looking at what do I need to change in my diet? I need to understand my genetics. I need to understand what am I going to be passing on to my child? And I would want my wife to be doing exactly the same. Find out what are the things to reduce inflammation, to increase digestion function, or increase detoxification pathways, etc., that makes her perform better. Mm-hmm. Then when they conceive, that child hopefully has the most incredible biology happening. The mother through the pregnancy constantly thinks, and now we're going back to the worried, well, we mustn't do that. But she should be delighted by the fact that she's carrying this uber child. Mm. And on birth, my encouragement to all women, please, wherever possible, have a vaginal birth, a normal birth. You cannot believe what it does to your child. It inoculates that child with bacteria for their gut, which is so, so, so important. And cesarean, unfortunately, does not do that. And I believe children not born vaginally have a increased risk of gut issues, digestive issues, because they simply don't have that environment. Then the next bit, as you rightly allude to, breastfeeding is immensely important. Mm-hmm. There's so much documentation, but it's not just important for the for the child, it's in fact important for the mother, because that is part of her recovery. Both the vaginal birth is a part of the process of recovery, so too is the breastfeeding. And in fact, there are studies showing that women that breastfeed have a reduced risk of breast cancer because of functions that the body is able to do to revert back to her pre-pregnancy state. So I think it's very, very exciting, and normal biology, normal things is what was supposed to happen.
Yeah.
Why do we keep challenging what our human biology is? Why do we keep changing it? Why do we want to give our child a formula? Why do we not want to have a normal natural birth? I understand the physical challenges. I'm not a woman, therefore it's very easy for me to talk about it. But the logic is protect the integrity of humans by doing what humans were always supposed to do.
So, Chris, that's a brilliant analogy. Now, if you were to advise a couple getting pregnant, what would be your advice be?
Okay, first of all, preconception, you're going to clean your diet up. Get rid of the ultra-processed foods. Get rid of the toxins. Make sure the water you're drinking is clean. Don't drink sodas. Drink water so that it provides your body with the environment to be clean and high functioning. Then test to see how you're going to carry the child. So the mother does the Grow Baby genetic test. We will be able to understand how she can carry that child. We will be able to then point her in direction of counselors that can help her change her diet, change their approach to the pregnancy, and protect the integrity of that unborn child. And information suggests that she'll be able to carry her child to birth. Please then have a natural birth, and please do breastfeed your child.
I think that's a brilliant message. And I think we can end it here with saying that we have the means and measures to be high performers, to have healthy pregnancies, to have healthy babies, and to have wealthier lives. Because I believe at no point your health should be compromised. And I believe that it's the wealth that we build in terms of our health.
Absolutely.
Because tomorrow we're sick. What are we going to do with all the money that we have?
Absolutely. I totally 100% agree. Build integrity around your health, because you will perform better in every aspect.
Yeah.
And children born to parents that have done that will also benefit tremendously intergenerationally. The more you do for your children, the more they will be able to perform, and the more your grandchildren will be most likely even better than your children.
Thank you, Chris. I think it's been wonderful.
It's been
amazing to have this conversation with you. And I don't ever think this is going to be our last conversation, because we have so much to unpack. And thank you for your time.
It's been a pleasure. Thank you so much for having me.
Thank you so much.